So we're talking to Jennifer Montgomery today. Jennifer is an RSD patient and we videoed her before, but we had lots of complaints about the sound. So today we're doing a better job.
Good.
So Jennifer, how long have you had RSD
Since
for?
2007, and a stress fracture on my right foot, and then I developed RSD after that.
Okay. And tell me what your life is like with RSD.
Painful. It's hard to do anything. It's hard to walk. It's hard to work. Concentration is hard, and you live your day 24 hours a day in pain.
Does anyone truly get your pain level? I know your husband Dick is very supportive.
But nobody else has ever, if they haven't had pain, they don't know how to deal with it. And it's hard, because people say there's nothing wrong with you.
So I want to talk a little bit about the things you've tried. You have not tried very radical things. You haven't done ketamine.
No.
You haven't done the Calamore.
No.
Any particular reason why you haven't?
I've never heard of it around here.
Okay, so you were just kind of stuck in Arkansas and thought your options were pain control?
Pain control and more pain control, and that's all they, and a lot of people in Arkansas don't know anything about it.
A lot of people everywhere don't know much about it.
And all they want to do is, well, just take another pill, take another pill.
Were you taking pretty serious medication?
Yes. I was on maximum doses of Lyrica, 600 milligrams twice a day, on Cymbalta, 90 milligrams twice a day, and morphine. And they just kept taking more morphine, more morphine. And right now, I'm taking nothing.
I did not know that.
Yes. Since I started treatment, I'm not taking anything.
So did the pain medication help?
No. Nope. I think what it does is just doesn't let you function doing anything, so then you think the pain's better. But the pain never went away.
And what did it do to your life? I always say pain is one thing, but it keeps you from your life. So what are some of the things like cooking that you missed doing that you
standing cooking, having to have somebody help me cook, not even being hungry anymore. And it just takes the fun out of your whole life. You can't play with your grandkids, you can't go for walks, you can't, it's hard to drive.
Did you leave the house much?
No. Nope. No, because I wasn't really with it enough to go anywhere, or if I would drive, I was afraid I'd get in a wreck, or my foot, I never knew how my foot would react, so I didn't.
Okay, so now a little bit about our history. 5 years ago, I tried to help you when I was new in working with RSD, and you were my only patient back then that I couldn't help.
Right.
Because I was getting good results right away, but not with you.
Nothing with me, nothing. And I think I got scared too.
You haunted me. For 5 years haunted me, but we stayed Facebook friends.
Yes.
And I think you contacted me and said, do you know of anyone that can do, anyone that understands pain control for RSD?
Right.
And I said, what about me?
And here I am, and I'm so glad I came.
And you've been how many weeks in treatment?
Is this 5 weeks?
Okay, tell me, first off, where is your pain right now?
It's at a 0. Right now, today, it's at a 0.
She said it. She said
and I said it. Yay. Otherwise, when I came, my pain was at a 10. They could hardly touch me or do anything. And 5 weeks it's taken. This week. It's finally 0.
Can I touch your foot?
You can try. Yeah.
So it's holding today.
Still a little sensitive?
It's a little sensitive.
I used to not be able to get close
No, you couldn't even get close to it. And I can touch it. And I finally, not last night, the night before, went to sleep all night. For the first time in I don't know how many years.
Years?
Yes, because it interrupts your sleep. It wakes up painful. I couldn't have covers on it. It's hard to wear shoes. So it's like, I can't wait to come here.
And now a lot of people will say, okay, that's great to hear about this patient's results, but you're not telling us what you're doing. And I think that's frustrating to people. So let's talk about what we do in here.
Okay.
We've got 3 what we call big wig treatments in here. I've basically searched the world and I combined these 3 treatments. All 3 of them get results with RSD, and I thought, well, why don't we just combine all 3 and make the super recipe? No, if you can make a small cookie, why don't you make a really
Big one.
big, awesome one with chocolate chips? So we use quantum neurology to rehabilitate the sensory nervous system. So your sensory nervous system consists of vibration, light touch, which is unbearable for RSD, directional pressure, circumferential pressure, cold and heat. And we basically show the brain that your sensory nervous system is malfunctioning or broken. And if the brain sees the injury, it can fix it. And we have a specific process with that using the quantum neurology. That makes your results stick longer. Then we use an upper cervical procedure because tell me about your spine. You've had spinal
I've
issues.
had a back surgery 2 years ago, which they have a cage around with metal screws and plates in.
Did you ever have a car accident?
No,
Okay.
never.
But your neck was always giving you
And I always got migraines. The first time I came, I got a huge migraine.
It is, and that was 5 years ago. I'm just going to add that in. I'm much better at that now.
Yes.
The missing part with RSD that most doctors leave out is the central nervous system and the very upper cervical spine. That has to be treated in a very specific way. These patients usually have an old upper cervical injury or a tailbone injury that is untreated that affects the central nervous system. So we do not numb the pain, we don't interrupt the pain signal. We treat the central nervous system injury, and that's the only way I think you're going to make a permanent difference with the neurologic symptoms instead of trying to mess the pain signal out. The fire's still burning inside the body. Nobody's fixing that just because you killed a fire alarm.
Right.
And then our last treatment is frequency-specific microcurrent, and Deb helps with that. She's the genius.
She's the wonderful one.
And that sends a microcurrent through the body that targets specific abnormal tissues, scar tissue, the implants in her spine. We treat her for metal allergies because of that. We treat inflammation of the spinal cord, inflammation of the nerves. Lots of people with RSD have narrowing of the canal that the spinal cord sits in, called stenosis, and we have to treat that. So those are the treatments we combine. Tell me, how many times a week do you come?
Twice a week.
You're on a very light schedule.
And right now we're down to an hour each time, which is wonderful.
How have the last 2 days been?
Wonderful. No, pain-free. It's like, this is the first time, and I'm amazed.
And tell me real quick, I don't want to talk about money too much, but people do bring it up all the time. I know that was a big stress for you. What would you say to people when they say, well, my insurance should cover this, my workman's comp should cover this, it's not fair that I should pay out of pocket?
I don't think I will pay anything to get over this, and I don't care what it's worth. I mean, if the insurance company won't pay for it, that's fine, but they'll pay for the medication and they won't pay for something that cures. I don't even know if it cures, but it stops the pain, and that's priceless to me.
Thank you so much for taking
Thank you.
the time. I really appreciate it. I'm
Thank
so
you.
excited for
Happy
our
birthday.
Thank